Hi, everyone. I'm really excited for our next partnership with Carbon Health, where we're joined again by Dr. BCW, who is the Medical Director of Community Engagement and Equity for Carbon Health. And it's really special today because as we're entering October is Breast Cancer Awareness Month, and that's what we'll be discussing today. And I want Dr. BCW to just give everyone a brief overview of what even is breast cancer.
Well, first, Dr. Rob, thank you for having me. I'm so excited to be here to talk about this important topic, as well as answer everyone's questions. Thank you for just reaching out and asking us, what would you like to know about breast cancer? So when we talk about breast cancer, it is when cells inside the breast have divided without any sort of supervision or restriction. And so when I say that, I mean that there's this abnormal level of division that's happening where cells are no longer acting as they normally should.
Now, what could somebody begin to look for related to symptoms of breast cancer if they're experiencing this abnormal growth?
So it's really important that some people have no symptoms. And so, that's something that you have to remind yourself that you may not have any symptoms. Now, some of the things that we have seen associated with breast cancer are a change in the color of the skin on your breast, as well as a change in the texture, as well as dimpling, meaning there's like a retraction in the skin. Nipple discharge is also one that people forget. And so if you are not breastfeeding and you are noticing any sort of substance, blood, anything coming from your nipple, that can also be a sign. Another big thing is if you do have pain, that is an important factor to go in. And we want to be thoughtful that we remind ourselves that it may not just be the breast, it could also be the armpit as well. And so if you have any pain in any of those areas, definitely go in and be seen.
And if we begin to think about somebody who does have some of these symptoms, they go in and maybe they begin to get screened. What are some statistics that they're looking at related to, would this abnormality definitely be breast cancer, or could it, not be and just be some type of abnormal tissue growth that isn't related to cancer? Do we have any large scale statistics related to who's kind of susceptible to this?
So we do. We know that first and foremost, it's always important to know that the majority of breast cancer has no association with family history. So that's an important thing. Now, that being said, there are those risk factors that are associated with family history. So if you have a first degree relative that has been diagnosed with breast cancer before the age of 50, if you have had anyone, in your family that's been diagnosed with breast cancer is an important piece, as well as if you have a male figure in your family that has been diagnosed with breast cancer, that can be another sign. The other thing we forget about is ovarian cancer. If you have a family history of that or have been diagnosed with that can be also another risk factor. And so when you go in and get your mammogram, they're going to ask you these questions because that really helps set, the schedule of how we continue to monitor you, as well as what type of test should we do? Because there's so many out there, as you know. And so when I think about this, I think it's a good question to kind of consider, how does breast cancer even evolve? And I'd love to hear from you about the genetics about it.
Sure. So when a lot of people think of breast cancer related to genetics, they're usually referring to BRCA gene mutations. That's BRCA. And these are specific genes that are found in all of our tissues that are responsible for actually repairing DNA damage. So our DNA is constantly under a lot of pressure. It's being damaged by both internal factors as well as external stimuli that we are receiving on a daily basis. And we probably have DNA damage ongoing right now, but our cells are actually responsible for fixing those problems. So it's kind of like when you have a bump in the road, they're going to come through and they're going to repave it over so it's nice and smooth. And BRCA genes or BRCA proteins are actually involved in that pathway. So when we start to think about BRCA gene mutations, it means that those proteins aren't actually working the way that they're supposed to. So they're not fixing that DNA damage that's occurring inside of our cells and specifically in our breast tissues. So then that can allow for those cells to begin growing uncontrollably, just like Dr. BCW said in the beginning, and then causing a tumor or causing cancerous tissue to grow. And those are kind of some of the things we look out for when we're doing genetic testing related to BRCA gene mutations or breast cancer in general, because those are just some of the proteins involved and some of the things that we're most aware of in order to look out for. So segueing off of the genetics that are related to breast cancer, there's also been a concern that's related to soy or some other dietary choices and how those may impact one's risk for developing breast cancer. Would you mind touching on that concern a little bit?
Yes. And this is, a wonderful question. There's been so much discussion about soy and how is it involved in breast cancer. So before, there was this thought that soy actually increased your risk for breast cancer. However, some studies have actually shown that it doesn't. It's important that we talk about this new distinction. And so when we talk about food and soy-rich foods, it's been shown that, having a lifelong consumption of soy-rich foods can actually reduce your risk for breast cancer. And it all kind of goes back to the factor of what we call isoflavones. And so that was the concern, with it related to estrogen, could that increase your risk? Now, that being said, if you are taking a supplement or soy outside of it being packaged within food, that can, per studies, possibly increase your risk for cancer. And so, this is a great question and ongoing discussion to kind of look at, what things do increase our risk. Now, I always like to think of positive pieces as well. And so what we do know is eating, berries and fruits and other factors are just overall good for our health. And so you just have to kind of make the decision for yourself and, what things that you want to eat in order to stay as healthy as possible.
Yeah, and that connects perfectly with what we were just talking about genetically, because those fruits and veggies are going to be packed with antioxidants. And when we talked about DNA damage, something that happens in our own bodies is related to something called reactive oxygen species or ROS. And antioxidants kind of come in and they eliminate ROS. So it's like a very protective way in order for us to give a protective layer to our own DNA.
I love that. And it's just amazing that there's so many things around us that we can do just to help protect us from cancer and other things like that are just overall healthy, not only for your heart, but for your overall body and your mind. I think when we eat good, we feel good, and that really just comes out in so many different ways.
And, moving from the genetic side of breast cancer, I also wonder what could treatment options look like for individuals when they come in and they do have a positive case of breast cancer that's detected?
So, great question. Because there are different types of breast cancer, that type of cancer and the treatment associated is really directed towards the type of breast cancer that you have. And so depending upon if there are certain types of hormones such as estrogen, progesterone, certain receptors found, that really guides as far as the type of treatment that will be directed for your type of breast cancer. And so I would love for you to talk about, some of the clinical trials. We have made such progress in the realm of treatment and clinical trials towards breast cancer. I would love for you to share some of those factors.
Absolutely. So when we think of cancer, a lot of times previously, it was just kind of take out the tumor, take out the tissue that's affected and hope for the best. Maybe we have some radiation that can ongoing, but that's really destroying both the cancerous tissue as well as healthy tissue. So pushing forward to try to find better treatment options that really just target cancer has been of the utmost importance in the medical and the scientific community. And that includes breast cancer, but also for a variety of other cancers as well. And we've made a lot of progress related to some types of treatments that could be monoclonal antibodies, for example. So maybe you've heard of the drug Herceptin. So that's actually used against HER2 positive breast cancer. And there's other antibodies that are being used right now in clinical trials to try to combat different forms of breast cancer as well as others. And we also have small molecules. So those are our typical chemistry made substances that are able to target specific pathways. Maybe they stop the vasculature or getting blood supply to a tumor, and then they can kind of cut it off and starve that tumor of nutrients. Or now we've seen the importance of mRNA technology being used in vaccines, but that's actually also being used in cancer treatment. That's something that I was doing in my PhD research as well, was using mRNA as a therapeutic for liver cancer. So that's beginning to transcend into a lot of different topics, which I think is just huge, and also a breakthrough that we might be able to see within the next couple of years for breast cancer, but also other types of cancer too.
See, I love that. When you talk about that, Dr. Rob, it really shows, the advancements that we're making. The other thing that has also been really helpful for clinical trials, we know historically in the past, the trials were primarily in Caucasian and white women. And now there is a better understanding that we need to include women of color to really understand all of the biological factors, all the things that could be a part of that, so we can better, treat all people. And when I say that, I mean anyone who identifies as a woman, anyone who can get pregnant. And that's the goal. When we talk about really helping and making change in breast cancer, we have to really be mindful to include everyone.
And do you have any statistics related to individuals of color who maybe experience breast cancer at a different rate compared to what some of these general statistics have used in the past several decades?
I do. So when we talk about breast cancer and Black women versus white women, there is a stark difference. And so although breast cancer is more common in white women, Black women are dying at a disproportionately rate from breast cancer. We are also getting the more aggressive type, meaning triple negative breast cancer. And so when you think about that, the fact that number one, there are studies that have been shown that we are diagnosed later, and then when you're diagnosed later and then you have a very aggressive type of breast cancer, that culmination of the two really increases our risk of dying from breast cancer. And so that's something that, I really encourage any, woman of color to really think about your risk factors and get screened. And currently right now, the guidelines are, for breast cancer screening are different depending upon which type of national organization that you want to follow. And so one that I like is the American Cancer Society. And so they recommend from ages 40 to 45 to really take a personal look at your risk factors and see if you, feel that you should get a mammogram. And that's one thing that I really stress, that don't feel like you have to wait to a certain age to go and get it. The other thing that's important to know, when we were talking about family history, if you do have a family history of breast cancer, we actually want you to get your screening done about 10 years earlier than the person who was diagnosed in your family. So those are two things to really think about as far as screening. And I know we're going to delve a little bit deeper into the guidelines, but it's just important to really know that if you're a woman of color, that you have a higher risk of getting an aggressive type of breast cancer.
And when we begin to think about getting a mammogram, now if somebody did go in and they got a mammogram, whether that was clear or they had some abnormal results, what is their timeline in terms of should they be going the next year? Can they wait a couple years? And also, how does that affect the ones thinking of going back to getting a mammogram if maybe they have had some adverse results that they've encountered?
So this question, as you know, Dr. Rob, is close and near and dear to my heart. And so it's really important that when you get your mammogram, if you do have an abnormal result, they are going to recommend that you do a follow-up, such as a diagnostic mammogram, to be able to see things, clearer. And so some of the things that might warrant a closer look would be calcifications, which are just the calcium deposits within the breast, as well as if you have dense breasts. That is another reason where the mammogram may not be able to see everything as clearly as it should inside your breast to identify any abnormalities. And so why I say this is near and dear to my heart, last year I decided to go ahead and get my first mammogram. And I decided to memorialize it because I was hoping as a Black female physician to be able to connect with my patients and really share the importance, but do it in a way that was non-traditional. And so through that, I ended up getting an abnormal result. And I thought to myself, when I received that call, how many people had I seen or called me and said, Dr. BCW, I got an abnormal result. I don't want to get a diagnostic or follow-up study. And so I felt those same fears. And I was like, it was just a whole new level of connectivity, which is healthcare and my patients. So I ended up getting that diagnostic. I recorded that as well, just in hopes of understanding the importance of pushing forward, even if you do get an abnormal result. I am so grateful that the calcifications that were found on my mammogram were normal, but I have to continue to follow up. And so that's something that I really want to share with everyone listening, that, you have the opportunity to save your life and also have information that could save someone in your family's life. And so use that as your superpower, as your kind of motivation to go forward and get screened.
I think that that's a really nice story, and I really appreciate you sharing that and being vulnerable with the community, because I think that's going to connect with a lot of different individuals. So now I want to segue into another subset of questions that were given by the community. And that was, we've talked a lot about women or individuals who can get pregnant and their risk factors for breast cancer, but also questions were coming into what are the risk factors related to men or transgender individuals related to breast cancer? Is there any type of statistics we have on those individuals?
So it's so important that we talk about this because men can get breast cancer. And so we know 1 out of every 100 cases of breast cancer, a man is diagnosed. And so it's so important that we highlight this. And so when we talk about symptoms, for those who identify as a man or a woman, they are the same. And so it's important that we talk about that if there's any dimpling, any retraction of the skin, nipple discharge. Another thing that is important, if there's any redness or flakiness around the skin or any moles and so forth, that can also be a sign of breast cancer. The other thing is when we talk about family history, men should, really take note if they have someone in their family that was diagnosed with breast cancer. That increases your risk as well. So it's not just for women, it's also for those who identify as male or men, that you take note and you look at your family history if you can.
And where could somebody go in order to, get this type of either treatment or get a diagnosis? Do they have to go to a primary care, or could they even do that at urgent care? Is there a multitude of different ways that they could go about, getting checked out?
Yes, there are. And it's, wonderful that we have so many opportunities for you to invest in your health and get screened. And so for your traditional mammogram screening, there are so many different ways. So one is through primary care. And of course, at Carbon Health, we have it. And so you could come in and we are happy to go ahead and order that screening for you. Another thing that you could use is urgent care. And so often in my urgent care shifts, I see, people who come in and they've noticed a change, or they have a nipple discharge, or just another important piece is, even if you're not sure if this is something new or has always been there, or is this possibly something that could be related to breast cancer, come in and be seen. And, we can order a diagnostic mammogram. So utilizing all of the, opportunities that are out there to get screened is so important. And if you don't have a primary care, you can also reach out to different resources, different organizations that have mammo vans that you could go in and get screened. And so I really, encourage everyone to kind of look out there and see what options are available and which one is best for you. Because in the end, you want to feel comfortable. You want to be in a place that can really give you information about your breast health.
So the majority of individuals know that they can go in for a screening via mammogram or an ultrasound. So a lot of people were asking questions like, how are they different, but also how are they similar? Are they the same? Would you mind giving a little bit of information for those community members curious about those two methods?
Yes, this is a great question. And so when we look at mammograms, it's an x-ray. It's a picture, of your breast versus ultrasound, it's sound wave. And so when you look at a comparison between the two, mammogram is preferred. And the reason why I say that is if you have any calcifications, it won't be picked up on ultrasound. And so that's something to really think about when you go in and get screened. I really recommend that you use the best modality possible. There's also a 3D imaging available as well that some patients may decide to get. And so there's different opportunities out there, but you really need to find out which one is the best fit. But again, getting screened, getting a mammogram really is the first step and the best step to just kind of knowing your overall health.
I'm glad you mentioned that. Going in and starting that process, that's a step in the right direction for sure.
Yes.
So that wraps up our discussion about breast cancer for now, but I also want to give an opportunity for Dr. BCW to let everybody know where they can go and find her on social media so they can continue to learn more, not only about breast cancer this month, but also about a variety of other educational topics that she is putting out.
Thank you, Dr. Rob, for having me. You can find me on all social media platforms with Dr._BCW. And I just want to say a big thank you to you. This has been such a love being able to share health information in a digestible way. And I would love to just say thank you to all your followers for asking their questions, allowing us the privilege to just help you on your health journey. So this has been a wonderful opportunity, and I can't wait to continue to answer more questions.
Yes, likewise. I think that we will be back together here soon. And, as October continues, please share this information with not only your own family members, but also with others in the community as we can bring more awareness to breast cancer, get those screenings out there, and keep more people safe and healthy. So with that, we will chat with everybody soon and stay tuned on what our next topic will be. So thank you, everyone.
Thank you.
Bye.